State and federal officials are cracking down on opioid use in Tennessee, and not just for people who are abusing the drug.
News Channel 5's Kimberly Davis has more on how people who suffer from chronic pain are now feeling the crackdown too.
Show us that the drug has taken over some level of self-control that the patient used to have.
Shooting, burning, or aching could be words that someone with chronic pain describes the task of walking their child to school.
We know that people start opioids from having prescriptions, from having surgeries or undergoing procedures that are painful.
And many primary care physicians have stopped seeing patients who have chronic pain.
This problem didn't happen overnight. It has been building for the last 10 years.
Not only is it an insurance issue,
I see a lot of those kinds of patients.
but Dr. David Edwards says people with chronic pain are suffering from the rising fear of opioid abuse and drug overdoses.
With the focus on weaning and coming off opioids, they're not for chronic pain. You know, there's a lot of patients amongst those that aren't using them because they're addicted to them. They're not abusing them. They're not doctor shopping. They're using it to be functional, to work.
And people with chronic pain who have long-standing conditions of illness and have been effectively treated are now on their own.
Can you imagine just tapering someone off of opioids who's been on them for 10 years?
Federal and state officials are concerned with the growing problem of opioid addiction in Tennessee, and now doctors are faced with the task of determining who was addicted to the medication and who was dependent.
If I don't have my caffeine in the morning, probably I'll have a headache that day. But I'm not going to quit my job and go seek out a cup of coffee.
But for a patient who was addicted,
They'll drop out of school and focus on that. They'll lie or they'll steal from someone else to get the medication. Or they'll abuse, they'll go out and buy an alternative such as heroin.
Dr. Edwards says there are other options to treat chronic pain, but it is not as effective as opioids. I'm Kimberly Davis, News Channel 5.
14% of adults have chronic pain, and 20% of patients visiting a doctor's office with pain are prescribed an opioid.
You wouldn't want to